How do we not bleed to death during surgery? How is our body cut open for a long time, and yet we don't bleed out? For almost all surgeries, there is little to no bleeding, less than a teaspoon. The body is organized into layers, like an onion. There are layers where there are no blood vessels, and if you work through those layers, you do not disrupt the vessels, and there isn't much bleeding. When we find big vessels, we put stitches around them and tie them off to prevent bleeding. Lastly, the tools that we use have the ability to use heat or electricity to zap blood vessels and stop bleeding. There are lots of reasons that patients don't bleed out, a non-comprehensive list. Surgeons avoid severing major veins arteries whenever possible and use hemostats to control bleeding. Minimally invasive surgical techniques can reduce bleeding significantly. Cauterizing scalpels help control bleeding. For example, the patient's blood may be captured and recycled/blood may be transfused. People having open heart surgery are put on bypass and have their blood recirculated and oxygenated by a nurse perfusionist. In traumatologic surgery, they often operate on the limbs under ischemia by interrupting the blood flow to the extremity. These surgeries are surreal in that patients don't bleed at all. One of the things anesthesia achieves is lowering blood pressure quite a bit. This also reduces bleeding drastically.